Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today I am here with the one more important topic in cardiovascular system, heart failure. So, what kind of question you are going to actually face when you're having the exams is like, will you just give this question, one line question, and you'll be like, let's take into it. The question will be like, define, describe the etiology, pathophysiology, clinical features, investigation, and at last, management. If you split the marks, like most of the thing will be given to the pathophysiology and clinical features. Let's try to concise the notes and make the topic quickly revisable. So definition goes like this. Heart failure is a clinical syndrome in which heart is unable to pump sufficient blood to meet the metabolic requirements of tissues or can do so only at the elevated filling pressure. There are hundreds of definitions. I felt like after comparing this was easily memorizable. So I put this definition. If you're already studied some other definition or you have some like what you say Harrison textbooks definition you by heart, then you can go with that. Then coming to etiology, we have common causes which you have to know. Then less common causes. These are for just like tukka, like if you want to fill the pages. First thing, ischemic heart disease, IHD, hypertension, valvular heart disease, cardiomyopathies, arrhythmias. In less common, we are going to see congenital heart disease, pericardial diseases, endocrinal disorders, anemia, then CKD. Pathophysiology, you need to draw diagram like if you want, or you can just write whatever I'm giving. Just read this 2 to 3 times, and during your exam, just revise once. We'll be done with it. So, in pathophysiology, I divided the like into 3 categories. Where first thing, it will be reduced cardiac output, or it may be due to compensatory mechanisms, or it may be due to ventricular remodeling. No need to dig more because like if you see the playlist, like I will try to explain more detailedly in some other videos about this pathophysiology part. Then reduced cardiac output, what it leads to? Usually like myocardial dysfunction leads to reduced stroke volume. Now don't ask what is stroke volume, okay? You need to find out and use the comment section to tell me, okay? Do some homework. Then which leads to inadequate tissue perfusion. Then coming to compensatory mechanism, we have 3 subtypes. It may be due to Frank-Starling mechanism, or it may be due to sympathetic nervous system activation or renin-angiotensin-aldosterone system activation. No need to read this much. You can say RAS system. Okay. Increased ventricular filling improves contractility initially, leads to ventricular dilation over time. In sympathetic nervous system, what happens? Increased heart rate, contractility, which leads to peripheral vasoconstriction. Then coming to what do you say, RAS system, sodium and water retention will take place, increased preload and afterload. You people will be studying long-term, what you say, compensatory mechanism in physiology, cardiovascular system. If you have not read, just go once and watch wherever available video or textbooks, standard textbooks, or even I preferred for physiology, I studied Sembolingam. For CVS, okay, you can just go and see wherever it is explained. Important topic, concise. But if you know that, you won't get confused in the further videos. What is meaning of preload and afterload, you can go and see. Then ventricular remodeling, structural and functional changes of myocardium, which leads to progressive worsening of heart failure. Just think, there is a house which is built like 100 years back, and if you try to give more, what you say, hang more things or on, walls will collapse obviously. So that's what happens here. Structural or functional changes will be taking place, which affects the myocardial actual function or capacity of the myocardium, which leads to worsening of heart failure. Contributing factors like that. Then coming to clinical features, we have symptoms and signs. When it comes to medicine, you have to write, you have to try to make the answer in clinical features like it should be like symptoms and signs. So in symptoms, you have to do specifically for heart failure, you have left-sided, then right-sided. Don't study at a time both sides. Like you can't even focus on one thing. You'll get confused, and you in exam you'll write right side to left side to right side, and the examiner will be like, he don't even know the actual clinical features. So don't get confused, okay? Left-sided, you are going to see dyspnea and exertion. These are typical left-sided heart failure features, okay? No need to confuse with the right side. So first, wait, I'll teach these, then I'll give a pause, just pause the video, read them again, and then go to the right-sided. Dyspnea and exertion, orthopnea, PND, cuff with phrotosputum. If you have not seen my general, what do you say, CVS examination per video, just go and watch once, like when you're bored or like when you're free or when you don't understand, like wherever the topics comes under which topic, you'll come to know. Then right-sided heart failure, pedal edema, you're going to see abdominal distension, right upper quadrant pain. In signs, you're going to face general examination, tachycardia. Obviously, if there is some issue in the heart, you're going to see the heart rate increased, so that is tachycardia. Pallor will be seen, cyanosis will be seen. Then cardiovascular typical signs will be raised JVP, displaced apex beat, S3 gallop. Like I want to give one more homework. If there is raised JVP, which chamber of the heart is affected directly? Use the comment section. Yeah, I'll see who has answered it first. Then S3 gallop. Then coming to respiratory, basal crepitation, pleural effusion. You would have noticed that I try to make symptoms separately. Then in signs, preferably you need to write like system-wise signs so that examiner will be impressed. Investigations, as usual, first you need to go with CBC, complete blood count, then RFTs for if there is any compensatory mechanism related issue, RAS preferably, then electrolytes, then BNP, NT-pro, BNP. If you want, like I'll make a separate video on investigations related to heart specifically, like imaging and even for blood investigations. Let me know in the comment section. Then coming to imaging, you're going to see chest X-ray just to rule out cardiomegaly, pulmonary edema. DDs you need to rule out, right? So that. Then ECG is one of the important topic. I'll be explaining very detailedly in the further videos. If it is available, you can watch, or like if it is not yet available, I'll be making videos soon. Echocardiography, just remember echo, 2D echo. One or the other people in your family member will be undergoing this chest pain and all, they'll be underwent 2D echo. So what we are going to usually see in this 2D echo, or like when people give you some 2D echo report, what you have to see is like, first you need to see ejection fraction. There will be something like less than 70%, more than 70, or even more than 30. If there is 30, then there is an issue. Or like there is compensatory scene, then fine. So if it is like less than 30, then there is actual issue. You need to ask them, like go again to get it get it checked by cardiologist. Then chamber size we are going to see, valvular disease. I'll be explaining 2D echo detailedly like for a 3 marker or something in the separate video. Then coming to management, it's a huge topic. For PGs also it is huge topic, but for undergraduates, like I tried to make some small thing. If you're more interested about heart failure and all, you can just go and study some standard textbooks. But this much I felt is sufficient for your final exams, because for 2 marks or 3 marks, how much you are going to write pages together are there for treatment. I think this is sufficient. General measures, you need to restrict salt because hypertension. Then fluid restriction, it should not overload the capacity of the heart. Then daily weight monitoring. Then treatment of underlying cause. Then you are like, whenever there is a patient with the chest pain, not heart pain, chest pain, then usually preferably general measures doesn't work. We have to go with the pharmacological management. So you have to know, like you need to study properly that what you say. If you are a 4th year, no need to go and study detail about side effects and all. For that is present in the pharmacology topics. Just try to brush up your knowledge. If you're in 2nd year or 3rd year, don't miss this cardiovascular. Like it's a huge topic. You're going to get a 5 marker or everything in the question paper. So just study the CVS and all. Like it will be easy when it comes to medicine topic. And like people gives you tablet, if you don't know what is the purpose of the tablet, then they'll say what doctor kya banega kya doctor banega re tu. So better study well. Pharmacology, one of the important subject. In diuretics, what happens, like preload and congestion will be reduced. AC inhibitors reduce afterload, improve survival. Then beta blockers reduce sympathetic overactivity, improve ventricular remodeling. Mineralocorticoid receptor antagonist reduce mortality, prevent fibrosis. Additional drugs, SGLT2 inhibitors, one of the important drug you're going to get in pharmacology exams, or even under the endocrinology, the diabetic topic. You need to know more thing about this. Then digoxin, ivabradine. Ivabradine, it's a new drug. Then coming to management of heart failure. If there is a acute heart failure, how you need to manage. No need to write this thing in the exam, but I thought like I can explain something to the undergraduates. So oxygen therapy, you need to give IV diuretics, preferably Lasix. Depending upon the severity, we will change the dose. Then vasodilators, then inotropes. Yeah, tell me what inotropes actually present in the casualty. Use the comment section, okay? Don't forget. There are 3 homeworks in this video. I'll be checking the comment section. Complications, arrhythmia, one of the important topic in medicine. Thromboembolism, again one of the important topic. Renal failure, cardiogenic shock. Cardiogenic shock, I think this is important topic in your physiology, not in the medicine, or like in surgery maybe. Then prognosis depends on etiology, ejection fraction. In YHA class, I'll be telling this in shorts or like one separate 3 marker video. Then response to therapy. Yeah, like you're giving your best efforts, but the patient is not responding it. What is the purpose of treating, right? It even depends on the patient response. So at last, you need to know summary of the topic is heart failure is common clinical syndrome caused by structural or functional cardiac abnormality. Early diagnosis and guideline directed therapy improve survival and quality of our life. First thing, when it comes to chest pain and all heart related topic, patient will be already in the panic. And if you don't manage the patient properly in time, you may lose the patient. So what all we learned in the topic is, let's quickly revise. Heart failure definition we learned, insufficiency of a blood pump. Then etiology we learned, common and less common. Then in pathophysiology, three main topics. Under that we studied in compensatory we learned RAS system importantly. Then coming to clinical features, we divided it into symptoms and clear signs. Then in symptoms, we have left-sided symptoms, then right-sided symptoms. Signs, like I said, you need to do it according to the systems. Then investigations, laboratory tests, and imaging. In imaging, you need to know more detail about ECG because you are going to go study more detail just because arrhythmias, it's completely diagnosed on the ECG. So you need to study well. Then management, yeah, you need to know more about pharmacological part. If possible, like I'll try to make a nice video of managing how you can manage actually a heart failure patient in the casualty or even on the OPD basis if he is a chronic patient. Then coming to management, like acute heart failure patient, you are going to give first, you need to give oxygen therapy because there will be no proper supply of oxygen to the patient's peripheries. There may be some complications he is going to face. And intravenous diuretics just to reduce the, yeah, there are two important mechanism of diuretics, afterload, and one more is that you can use the comment section. Okay, I'll be waiting for the answer. Then vasodilators, inotropes. Then complications, arrhythmia, thromboembolism, renal failure, cardiogenic shock. Prognosis depends on the response and what all the drugs and according to the treat therapy you are going to give on the guideline directed therapy. Okay, so that's all for the video. Don't forget to subscribe and share to your friends so that it helps for me and motivate me for the further media videos making. So thank you. Happy New Year.